Frequent urination at night, also known as nocturia, is one of the most common but often overlooked disruptions to healthy sleep. Many people simply accept it as a part of aging or a minor inconvenience. But waking up multiple times during the night to use the bathroom can significantly affect your health, energy, and overall quality of life. What if I told you that something as simple and accessible as the right food choices could help reduce or even eliminate this problem naturally? Nocturia isn't just about drinking too much water before bed. While that's one contributing factor, it's not the whole story. The root causes can range from overactive bladder, hormonal imbalances, and kidney function changes to diet-related inflammation and even hidden blood sugar spikes. That's why it's important to approach this from a whole body perspective, one that respects how nutrition can influence bladder control, sleep rhythms, and nighttime balance. Let's focus on something practical and effective: food. Not pills, not procedures. Just 3 powerful foods that have been shown to support urinary health and reduce nighttime urination. These foods work by calming inflammation in the bladder, improving bladder elasticity, reducing muscular spasms, and even supporting hormonal balance for better nighttime fluid regulation. One of the most beneficial foods for reducing nighttime urination is pumpkin seeds. They're often underestimated, but these tiny seeds are packed with nutrients like zinc, magnesium, and plant-based omega-3 fatty acids. Zinc is especially important for maintaining a healthy prostate and bladder tissue function. For individuals who experience nocturia due to age, related prostate changes, pumpkin seeds can offer gentle, natural support. Magnesium helps to calm overactive bladder muscles, reducing spasms that cause those sudden urges to urinate. Just a small handful of roasted, unsalted pumpkin seeds in the early evening can support your bladder health without burdening your digestion or fluid balance. Another excellent food to consider is Tart cherries. These are not only known for their rich antioxidant content, but also for their natural melatonin. Yes, the same compound that your body produces to regulate sleep. Tart cherries help promote deeper, more restful sleep, which in itself helps manage nocturia by strengthening the body's circadian rhythm. More importantly, the antioxidants in Tart cherries help to reduce inflammation in the bladder lining. A small glass of unsweetened tart cherry juice, taken 1 to 2 hours before bed, has been shown to improve sleep quality and bladder comfort. However, the key is moderation. Too much liquid too close to bedtime can backfire, so be mindful of your timing. The third food I recommend is cooked spinach. Spinach is a natural source of magnesium, potassium, and folate, all of which are vital for muscle relaxation and nerve function. Magnesium in particular is useful in calming the bladder muscle, helping to prevent involuntary contractions that lead to urgency. Cooked spinach is easier on digestion and is less likely to irritate the bladder compared to raw. Incorporating a serving of lightly steamed or sautéed spinach into your evening meal can help reduce nighttime awakenings and support a more stable urinary pattern through the night. Of course, food alone is not the only factor. The timing of your meals and fluids plays a crucial role. To minimize the risk of waking up during the night, avoid consuming large amounts of water or other beverages 2 to 3 hours before bedtime. Also, reduce or eliminate caffeine and alcohol in the evening, as both are known to stimulate the bladder and increase urine production. Make a habit of using the restroom just before you sleep, even if you don't feel an urgent need. This can help empty the bladder completely and reduce the chances of waking up later. Also worth noting is that consistency is key. These changes won't necessarily take effect overnight, but with regular intake of bladder, supportive foods, proper hydration timing, and some awareness around what to avoid in the evening, most people begin to see improvement within a few weeks. Better sleep, fewer interruptions, and a more refreshed feeling in the morning become real possibilities, without relying on medication or disruptive procedures. Lastly, while these natural approaches are effective for many, it's important to pay attention to your body. If frequent urination continues despite healthy changes, or if it's accompanied by other symptoms like pain, burning, or excessive thirst, it's essential to speak with a licensed healthcare provider. There may be an underlying condition that needs medical attention. But for most people, the journey to fewer bathroom visits at night begins with something simple: your dinner plate. The right foods, eaten at the right time, can restore balance, promote peaceful sleep, and gently support your body's natural rhythms. So the next time you plan your evening meal, remember healing often starts in the kitchen. Sleep better, live better, and let nature work with you, not against you. Frequent urination at night is more than just an annoying habit. It's a condition known as nocturia, and it can significantly disrupt your sleep, mood, and overall well-being. Many people wake up one or more times during the night with an urgent need to urinate, assuming it's simply due to aging or drinking too much water. But in reality, nocturia can be a sign of various underlying imbalances in the body, and understanding it is the first step toward managing it effectively. Nocturia is characterized by the need to wake up at night to urinate, interrupting the natural sleep cycle. Sleep is the body's most important recovery mechanism, and when it is broken repeatedly, it can lead to chronic fatigue, poor concentration, mood swings, and even weakened immune function. Over time, this lack of quality sleep may contribute to larger health issues, including blood pressure fluctuations, insulin resistance, and stress hormone imbalances. This is why taking nocturia seriously matters. The causes of nocturia can be complex and multifactorial. Sometimes, it is due to something as simple as drinking large quantities of fluids, especially caffeine or alcohol, too close to bedtime. In other cases, it may be linked to underlying health concerns such as diabetes, kidney conditions, urinary tract infections, overactive bladder syndrome, or even certain medications like diuretics. In men, an enlarged prostate, also known as benign prostatic hyperplasia, can lead to incomplete bladder emptying, causing the urge to urinate frequently at night. In women, hormonal shifts, especially after menopause, can affect bladder control and contribute to nighttime urination. There's also the role of aging to consider. As we grow older, the body's ability to produce and respond to antidiuretic hormone, ADH, diminishes. ADH helps the body retain fluid during sleep, so a reduction in this hormone means the kidneys produce more urine at night. Furthermore, bladder capacity may decrease with age, making it harder to hold urine for long periods during the night. This combination of hormonal changes and bladder sensitivity results in a greater chance of being awakened by the need to urinate. It's important to remember that nocturia isn't always caused by a medical issue. Sometimes, it's the result of poor lifestyle choices that can be corrected with simple changes. Drinking too much liquid in the evening, especially drinks that irritate the bladder like coffee, tea, soda, or alcohol, can make nocturia worse. Eating foods high in salt before bedtime may also cause fluid retention during the day and increased urination at night as the body tries to rebalance itself. Many individuals suffer from nocturia in silence, thinking it's normal or unchangeable. But with a better understanding of what causes it and a willingness to adopt more supportive habits, including dietary changes, this condition can often be managed naturally and effectively. Through small steps, such as adjusting fluid intake, incorporating bladder-friendly foods, and being aware of irritants, it's possible to reduce nighttime trips to the bathroom and restore healthier, more restful sleep. Frequent nighttime urination or nocturia often seems like a random or age-related issue, but in reality it is usually triggered by specific causes and lifestyle habits. Understanding these underlying factors is essential for anyone looking to naturally reduce or eliminate this condition. It's not just about how much water you drink before bed. Rather, it's a combination of what you consume, how your body processes fluids, and certain patterns in your daily life that could be silently contributing to those unwanted nighttime bathroom trips. One of the most common yet overlooked causes is excessive fluid intake in the hours leading up to bedtime. While staying hydrated is important for health, consuming too much water, juice, tea, or other liquids in the late evening can overwhelm the bladder during sleep. Even more problematic are beverages containing caffeine or alcohol. Caffeine found in coffee, tea, soda, and even chocolate acts as a diuretic, meaning it stimulates the kidneys to produce more urine. Alcohol also has a diuretic effect and can disrupt the body's natural hormone balance that controls fluid retention at night. If you consume these substances late in the day, you may be unintentionally pushing your bladder into overdrive during your sleeping hours. Diet plays a surprising role as well. Salty foods, processed snacks, and certain artificial sweeteners can cause fluid retention during the day and increased urination at night when your body tries to eliminate excess sodium and toxins. Some acidic or spicy foods may irritate the bladder lining, causing increased urgency, including during the night. If your evening meals are high in these irritants, they could be silently fueling your nocturia symptoms. Weight and physical activity levels also influence nighttime urination. Being overweight puts additional pressure on the bladder, especially while lying down. This pressure can increase the urge to urinate during the night. Inactivity, especially in older adults, can also contribute. When you are sedentary for long periods, fluid tends to accumulate in the legs and lower body. When you lie down to sleep, this fluid is reabsorbed into the bloodstream and filtered by the kidneys, increasing urine production and leading to more nighttime bathroom trips. Hormonal changes are another factor. As people age, the body produces less antidiuretic hormone ADH, which is responsible for reducing urine production at night. This natural decline means that the kidneys continue to produce normal or even elevated amounts of urine during sleep, which can trigger the urge to urinate. In women, hormonal changes after menopause may weaken bladder muscles or reduce the tone of the pelvic floor, contributing further to nighttime urinary urgency. Medical conditions are also a common trigger. Diabetes, especially when uncontrolled, can lead to excessive urination both day and night. High blood sugar levels cause the kidneys to excrete more fluid to help eliminate glucose from the bloodstream. Similarly, individuals with high blood pressure or kidney disease may also experience increased urination. Some medications, such as diuretics often prescribed for blood pressure or heart issues, can shift urine production into the nighttime hours if not taken earlier in the day. Even sleep quality itself can influence nocturia. If you are already waking up due to light sleep stress or conditions like sleep apnea, you may become more aware of bladder sensations and feel the urge to urinate, even if the bladder is not full. In such cases, it's not the bladder waking you up, but poor sleep patterns making you more responsive to mild signals that would otherwise be ignored. Diet plays a powerful and often underestimated role in supporting bladder control, especially for those dealing with frequent nighttime urination or nocturia. While many people instinctively focus on fluid intake when trying to manage bladder issues, the truth is that the foods we eat have a direct and lasting impact on bladder function, inflammation, hormonal balance, and even muscle control. Understanding how diet interacts with these systems can provide natural and lasting relief from nocturia without relying on medication. Certain foods have natural compounds that calm bladder activity, reduce irritation, and improve urinary tract function. At the same time, some common dietary choices can irritate the bladder lining, increase urine production, or promote inflammation that worsens urgency and frequency. That's why paying attention to not just how much you drink, but also what you eat, becomes essential in managing nighttime urination. A balanced, anti-inflammatory diet helps reduce bladder sensitivity. For example, foods rich in magnesium, such as leafy greens, nuts, and seeds, can help relax the bladder muscles and reduce spasms that lead to sudden urges. Magnesium also supports the nervous system and smooth muscle control, making it easier to hold urine for longer periods. Likewise, potassium-rich foods like bananas and sweet potatoes help regulate fluid balance in the body and support kidney function, which in turn helps reduce excess nighttime urination. Fiber is another key nutrient that indirectly improves bladder control. A high-fiber diet helps prevent constipation, which is often linked to bladder pressure and irritation. When the colon is full or strained, it can press against the bladder and increase the urge to urinate, especially at night. Including fiber from vegetables, fruits, oats, and whole grains can promote digestive health and reduce bladder discomfort. Hydrating foods such as cucumbers, watermelon, and celery provide moisture in a more gradual and bladder-friendly way compared to chugging large amounts of water. These foods can support hydration during the day without overwhelming the bladder all at once. On the other hand, very acidic, spicy, or processed foods such as citrus fruits, tomatoes, hot peppers, cured meats, and artificial sweeteners, may irritate the bladder lining and make it more sensitive to even small amounts of urine. The timing of your meals and snacks is just as important as the content. Eating large, salty meals late at night can cause fluid retention during the day and increased urine production at night. This is because the body tries to rid itself of the excess sodium and water while you're at rest. To avoid this, it's beneficial to limit salt intake in the evening and focus on lighter, whole food-based meals before bedtime. Bladder-friendly foods also support hormonal and metabolic functions that influence urine production. For instance, cherries and other fruits rich in antioxidants can help reduce oxidative stress in bladder tissues while also promoting melatonin production, a hormone that not only aids in sleep but also plays a role in regulating nighttime kidney function. Ultimately, a carefully chosen diet helps create a more stable and predictable environment for your bladder. By incorporating foods that reduce inflammation, support muscle control, and aid hormonal balance, and by avoiding known irritants, you create the conditions for more restful nights and fewer bathroom interruptions. This is not about following a strict or complicated diet, but about making simple, mindful changes that promote bladder health naturally and sustainably. When you nourish your body with the right foods, you're not just feeding your cells, you're giving your bladder the support it needs to function smoothly day and night. When it comes to reducing nighttime urination naturally, food can be one of the most powerful tools at your disposal. While lifestyle adjustments and medical evaluations are important, incorporating specific bladder, supporting foods into your daily diet can make a noticeable difference in how often you wake up to use the bathroom at night. Certain foods contain nutrients and compounds that help calm the bladder, reduce inflammation, and support healthy urinary tract function. Focusing on natural, whole foods can not only ease symptoms of nocturia, but also support better sleep and overall health. One of the best foods to include for this purpose is pumpkin seeds. These small but nutrient-dense seeds are rich in zinc and omega-3 fatty acids, both of which play a key role in bladder and prostate health. Zinc is essential for tissue repair and hormone balance, while omega-3s help reduce inflammation that may contribute to bladder sensitivity or overactivity. Research suggests that pumpkin seed extract can help improve urinary flow and reduce symptoms of an overactive bladder, especially in older adults. For men in particular, pumpkin seeds are known to support prostate function, which is closely linked to nighttime urination. A small handful of unsalted pumpkin seeds as an evening snack can be an easy and effective dietary addition. Tart cherries are another excellent food to support bladder health and reduce nighttime urination. These cherries are high in antioxidants, particularly anthocyanins, which help reduce inflammation and oxidative stress in the body, including in the bladder and kidneys. Tart cherries also naturally contain melatonin, a hormone that supports sleep regulation. Better sleep quality, in turn, can reduce how often you wake up and become aware of bladder sensations. A small serving of tart cherry juice, preferably unsweetened, about 1 to 2 hours before bed may help promote deeper sleep while also soothing the urinary system. It's important not to overconsume liquids right before bedtime, so a small portion is sufficient. Cooked spinach is another powerful addition for those struggling with nocturia. Spinach is high in magnesium, which is a mineral known to support muscle relaxation, including the muscles in the bladder wall. When these muscles are calm, there is less likelihood of spasms or sudden urges to urinate. Spinach also contains antioxidants and anti-inflammatory compounds that can help calm the bladder lining and reduce sensitivity. Cooked spinach is preferable to raw because it is easier to digest and less likely to irritate the gastrointestinal tract or bladder. Including a serving of lightly sautéed or steamed spinach with your dinner can help relax the urinary system by the time you go to bed. What makes these 3 foods so effective is not just their individual benefits, but how they work together to support a healthier bladder environment. Pumpkin seeds address hormonal and inflammatory triggers. Tart cherries help regulate sleep and reduce oxidative damage. Spinach supports muscle control and reduces spasms. Together, they offer a gentle, natural approach to improving bladder function and minimizing nighttime bathroom visits. Incorporating these foods into your daily meals doesn't require drastic changes. A few pumpkin seeds as an evening snack, a small glass of Tart cherry juice earlier in the evening, and a serving of cooked spinach with dinner are simple steps that can lead to better sleep and improved quality of life. These are natural food-based strategies that work with your body's rhythms, helping you take control of nocturia in a sustainable, side effect-free way. Managing nighttime urination through natural means is not only possible, it's practical, sustainable, and gentle on the body. By focusing on smart dietary choices, like incorporating bladder-friendly foods such as pumpkin seeds, Tart cherries, and cooked spinach, and combining them with strategic hydration habits, you create an environment where your body can rest, repair, and function more efficiently at night. One of the most overlooked aspects of bladder control is not just what you eat or drink, but when you consume it. Avoiding heavy fluids 2 to 3 hours before bedtime, limiting bladder irritants like caffeine and alcohol in the evening, and ensuring your last meal supports calm digestion and urinary ease can significantly reduce nighttime awakenings. Pairing the right foods at the right time helps your bladder stay calm, your kidneys function steadily, and your body maintain a more balanced fluid rhythm during sleep. Consistency is key. These improvements don't happen overnight, but with daily effort, most people begin to notice fewer disruptions and deeper, more restful sleep. And while these natural strategies can bring noticeable relief, always remember that if symptoms persist or worsen, consulting a licensed healthcare provider is essential to rule out any underlying health conditions. When it comes to managing frequent nighttime urination or nocturia, many people immediately focus on cutting back on fluids altogether. However, the solution isn't necessarily to drink less, it's to drink smarter. Hydration timing plays a critical role in how your body processes fluids, and when done correctly, it can significantly reduce the urge to wake up and urinate during the night. Alongside smart hydration, pairing your meals with the right foods at the right time can offer additional support to your bladder, helping it stay calm and controlled throughout the night. The human body follows natural circadian rhythms that influence kidney function and urine production. During the day, your kidneys are more active and better equipped to handle higher fluid volumes. As night approaches, the body naturally slows down urine production through the release of antidiuretic hormone. However, when fluids are consumed in large amounts too close to bedtime, especially water, herbal teas, or juices, this rhythm gets disrupted, forcing the kidneys to stay active through the night and increasing the likelihood of multiple bathroom trips. To work with your body rather than against it, it's best to front-load your hydration earlier in the day. Start your morning with a good amount of fluids to help your body flush toxins and stay energized. Continue to hydrate consistently throughout the day, but begin to taper your fluid intake in the late afternoon. By the time dinner arrives, focus on sipping rather than gulping liquids. Ideally, avoid drinking large amounts of fluids within 2 to 3 hours before bedtime. If you're thirsty later in the evening, take small sips rather than a full glass. This gentle tapering gives your kidneys time to process fluids before you lie down to sleep. In addition to hydration timing, the foods you pair with your evening meals can further support bladder health and reduce nighttime urination. Meals that are high in sodium or processed ingredients can cause your body to retain fluids during the day. Once you lie down to sleep, this retained fluid is reabsorbed and processed, resulting in increased urination during the night. Choosing whole, unprocessed foods that are naturally low in sodium can help reduce this fluid shift and support a more stable nighttime rhythm. Pairing bladder, supportive foods with your evening meal can make a big difference. For example, incorporating a serving of cooked spinach with dinner provides magnesium, which relaxes the bladder muscles. Including a small amount of roasted pumpkin seeds as a snack earlier in the evening delivers zinc and omega-3 fatty acids, which support urinary tract and prostate health. If you enjoy a small glass of Tart cherry juice for its natural melatonin content, drink it at least 1 to 2 hours before bed to avoid overloading your bladder close to sleep time. Avoid pairing your dinner with caffeinated beverages sodas, or citrus-based drinks, as they can irritate the bladder and stimulate excess urine production. Instead, opt for warm, non-caffeinated herbal teas like chamomile or peppermint if you need a comforting drink. Just make sure it's in small amounts and not too close to bedtime. It's also helpful to eat your last meal at least 2 to 3 hours before going to bed. This gives your digestive system enough time to process the food without putting added pressure on the bladder. Avoid heavy or spicy meals in the evening, as they can cause discomfort, indigestion, or bladder irritation, which may further disrupt sleep. Incorporating the right hydration habits and meal pairings into your daily routine creates a supportive foundation for better bladder control. These changes are not extreme or difficult. They are simple shifts in timing and food choices that align with your body's natural needs. Over time, they can significantly reduce the frequency of nighttime urination, improve the quality of your sleep, and enhance your overall well-being. Achieving sustainable improvement in managing frequent nighttime urination requires a consistent and holistic approach. Changes to diet, hydration habits, and lifestyle need time to take effect, and it's important to be patient and persistent as your body adjusts. Adopting bladder-friendly foods, moderating fluid intake before bedtime, and avoiding irritants like caffeine and alcohol are not quick fixes, but rather ongoing habits that support long-term bladder health. Making these changes gradually helps your body respond better and reduces the risk of rebound symptoms or frustration from expecting immediate results. Regularly tracking your symptoms and adjusting your routine based on what works best for you can lead to meaningful, lasting relief. In addition to dietary and lifestyle changes, maintaining a healthy weight, engaging in regular physical activity, and managing stress can play an important role in supporting bladder function. Excess weight and inactivity can increase pressure on the bladder and pelvic floor muscles, making symptoms worse over time. Stress and anxiety can also amplify sensations of urgency or cause more frequent awakenings at night. Therefore, adopting a balanced lifestyle that includes movement, relaxation techniques, and mindful nutrition enhances your chances of sustained improvement. Despite best efforts with natural approaches, it's essential to recognize when it's time to seek professional medical advice. If frequent nighttime urination continues to disrupt your sleep and daily life despite making dietary adjustments and lifestyle improvements, this could be a sign of an underlying health condition that needs evaluation. Medical causes such as urinary tract infections, bladder or prostate disorders, diabetes, heart or kidney disease, and certain neurological conditions can present with symptoms of nocturia. Early diagnosis and appropriate treatment not only relieve symptoms but also prevent complications. Additional warning signs that warrant prompt medical attention include painful urination, blood in the urine, sudden changes in urinary patterns, swelling in the legs or feet, unexplained weight loss, or persistent fatigue. If you experience these symptoms alongside nocturia, consulting a healthcare professional becomes urgent. They may recommend diagnostic tests such as urine analysis, blood tests, imaging studies, or referral to a specialist to identify the exact cause. Remember that nocturia is a symptom, not a disease itself. Addressing it comprehensively means paying attention to both lifestyle factors and possible medical conditions. Partnering with your healthcare provider allows you to create a tailored plan that may include medication, physical therapy, or other treatments alongside natural strategies. Never hesitate to discuss your concerns openly, as quality sleep and bladder health are vital components of overall well-being. In conclusion, frequent nighttime urination can disrupt your sleep and overall quality of life. But with the right knowledge and practical steps, it is possible to manage and reduce these symptoms naturally. By understanding what nocturia is, recognizing its causes and lifestyle triggers, and making informed dietary choices, you empower yourself to support your bladder health effectively. Incorporating foods like pumpkin seeds, tart cherries, and cooked spinach, alongside smart hydration timing and mindful food pairing, creates a foundation for better bladder control and more restful nights. Remember, sustainable improvement comes from consistent habits and listening to your body. If symptoms persist or worsen, seeking professional medical advice ensures that any underlying health conditions are properly addressed. Taking these steps not only helps reduce nighttime urination, but also contributes to better sleep, improved energy, and overall well-being. Your journey toward restful nights starts with simple, informed choices, making every night a step toward healthier living.